Lesson 28, Health and Medicine. Hello and welcome to this lesson. Today, we are going to talk about health and medicine, how to describe symptoms, what the doctor might prescribe, and the language we use when we are not feeling well. This is very practical vocabulary because we all need to talk about our health from time to time. So, let us get started. What are your symptoms? First, let us look at how to describe symptoms, the signs that something is wrong with our bodies. There are many noun phrases we can use with the verb have got. For example, you might say, I've got a sore throat, that is pain in your throat. You might have a temperature, which means a higher temperature than normal. You could have high or low blood pressure. You might have chest pains, backache, or earache. You might have a pain in my side, a rash on my chest, a bruise on my leg, for example, after playing football, or a black eye, after being hit in the eye. You might have a lump on my arm, indigestion, after eating too fast, sickness and diarrhea, which is an upset stomach that makes you vomit and need to go to the toilet frequently, sunburn, or a virus. Now, let us look at some verbs we use to describe symptoms. My back is aching. I should not have lifted all those heavy boxes. My leg is itching. I think I have been bitten by an insect. That means you want to scratch it all the time. My hands are trembling after the shock of falling down. They are shaking slightly. I had a headache and started shivering, which means shaking because you are cold, and I knew it was the flu. My foot hurts from where I knocked it against the table. And if you had a cold, it took you 2 weeks to get over it. That means to get better. A more formal way to say this is to recover from it. We also have adjectives to describe how we feel. I feel sick, breathless, meaning I cannot breathe easily, or dizzy, which means my head is spinning. I am depressed, exhausted, or stressed. There are also some other useful expressions. I have lost my appetite. I do not feel like eating, or I have lost my voice. I cannot speak properly. I think I have picked up a bug somewhere. That is informal for caught a virus or infection. I have broken my wrist, sprained my ankle, which means I twisted it, or dislocated my shoulder. She died of a heart attack. He contracted AIDS. An informal way to say this is got. My uncle suffered a stroke, which is a sudden change in the blood supply to the brain that can cause loss of movement. An informal way to say this is had a stroke. What does the doctor prescribe? Now, let us look at what the doctor might prescribe. That is, what treatment or medicine they recommend. The doctor might say, take a teaspoonful of medicine last thing at night. They might get the nurse to put a bandage on your wrist. That is a strip of material to wrap around an injury. You might need to have some injections before you travel to a place like the Amazon. These are shots given with a needle. The doctor might say, I am afraid you are going to need an operation, a surgical procedure. You might have to have your leg put in plaster until the break mends. That means a hard protective covering. Or the doctor might give you some tablets and tell you to take one in the morning and one at night. A common mistake to avoid. Before we finish, let us look at a common mistake. A surgeon operates on a patient. For example, they decided to operate on her and remove the tumor. We do not say operate her without the preposition on. So, remember, operate on someone. So, that is our lesson on health and medicine. These terms and expressions will help you describe symptoms, understand medical advice, and talk about health issues with confidence.